Hello, welcome to the Better Wounds podcast. Today, I want to talk a little bit about scars and scar treatments and when you can start all that, because that is a huge question. If you've got a wound after plastic surgery, everyone just wants to know, what is this going to look like? So, I am Heather Flexer. I'm a doctor of physical therapy, a certified wound specialist, the creator at betterwounds.com. And I talk to people all over the place after they've had plastic surgery and they're now recovering and they have an issue with healing, especially in times when maybe their surgeon isn't local, or um, they just feel like they need a second opinion on the wound healing. And so I work with a lot of people all over the place. And like I said, scars are one of the main concerns, right? Um, Now, your scar from the incision itself, right? If everything goes smoothly and you have no complications, that should heal well. Your incision stays closed, then you're talking about a couple of weeks out and you're kind of getting back to doing your regular life. And that scar is going to be purpley at first, likely, and it's going to continue to fade out to very pale or almost non existent. Especially the scars with plastic surgery are going to be different than, let's say, orthopedic surgery or after a trauma or something like that. Um, Obviously, they're meant to be fine and thin and almost disappear. So typically what you'll hear is that after a year's time, that's going to be like your mature scar. So you can expect some time, right? You need to give it time. And then after about a year, that's going to be what it's going to look like. And you'll hear that. That's pretty common advice. So how does that affect you if you've opened up a wound? Now, if you're talking about an itty bitty, like less than a centimeter or less than a dime size, you may have a little bit more discoloration in that area, but that if that heals fairly quickly, you should not have this huge scar that's going to be a big issue. Things that you can do to help that happen is to get your wound healed up as fast as possible. If you've listened to any of the other episodes, you may hear me talk about keeping things covered instead of keeping things open to the air. That's going to help you have a better, flatter scar when you keep it covered. It also helps the wound heal faster. So that's going to be, really important. The faster you can heal the wound, the faster and the better looking your scar is going to be. So that's something that we definitely want to do. Just get that thing closed. If you need help, you can reach out, talk to your doctor. Your surgeon may offer to do a revision if it's not ideal, but you see how it looks. You need to give these things time. So you can absolutely work on your nutrition, your hydration, keeping it covered, and that's going to help with your scar formation. If you are someone that has, one of the great ways for you to tell how you're going to scar is to look at how you've scarred in the past. So if you're someone that has raised, like a raised ridge or a keloid, that's absolutely something you need to bring up with your surgeon before you even really get involved in this procedure. If it's really going to give you the result that you want, is it worth it? But they may need to prophylactically treat you for the keloid. Sometimes they'll use some cortisones or different types of injections and things. Again, if you tend to keloid, you do want to keep it covered using some silicone. Silicone can help with scars. So when I'm talking about an open wound with using silicone, I'm talking more about a dressing, not that silicone tape. That silicone tape you want to wait to use until your wound completely heals, but there's different things out there in the marketplace that can be kind of confusing to the consumer out there because silicone is in multiple different products. So there are silicone dressings, and I'll link some below that can be used when you're healing your wound, and that also that like smooth property to the dressing where it doesn't adhere to the wound bed at all can be really soothing, and it also helps with preventing like overgrowth and having those cells that are growing to heal the wound like keep growing, and that can be a problem with scar formation. So if you're someone that scars with a raised scar, silicone products can be a great option for you. Now, once you have healed and closed the wound, then you can start looking into different scar type creams and lotions and tapes. But you don't want to do that if you have an open area because you may create too much moisture. So when you have an open wound, you're looking for moisture balance. If you're going to use this occlusive, thick silicone tape that doesn't absorb any drainage, while you have an open wound, you're going to create a wet, moist mess. So we don't want to do that. Save that silicone tape for when your wound is completely closed, and then you can use it at that time. So that some people like silicone tapes they come in sheets, they come in like pre-cut shapes. So sometimes around the areola or the anchor or the lollipop incision, they have silicone that is like perfectly fit to that. Some people like that. I recently had one client who had no problem using the silicone tape on her tummy tuck incision. That was comfortable to her, but she just got the ick using it on her breasts. So everybody's different. There's all these different products out there kind of for that reason, because everybody responds differently to different things. That also makes it hard to give you blanket advice. But some of this stuff is not very expensive, so you can kind of pick and choose and decide what you like. You don't need to buy anything up front. You can kind of wait and see and try things and see how it goes. I like those silicone tape rolls where it's not pre-cut and you can kind of cut to fit things as you want. So you can try that on your breast if you want, and then if you like it, you could order the shaped ones just to make it easier for you, or not. You may also get the ick, and then you can use silicone-based gels instead. There's even a silicone stick, it's like a sunscreen stick that I like a lot. And like I've recommended it to friends and things before. Someone had like a thyroid surgery, and so she had the incision right at her neck. It was pretty obvious, but it also is exposed to the sun. So your scars that are exposed to the sun, it's really important to use sunscreen. So she really liked the stick because, one, it was easy to apply, and two, it had sunscreen, and you can barely see her scar now. So remember, these things are going to take time, and you can experiment with different things. You may like a cream better, you might like the gel better than the tape. It's all cool. Like whatever works for you. It's just that you need to use things at the right time. So don't use any silicone tapes or strips or things like that until the wound is fully closed. We want to get that wound closed as fast as possible. And then once it is closed, we're ready to party. And then now we need to really make sure that we are doing our scar massages. So hopefully you're working with an in-person provider who can help you with that, and you can kind of learn from what they're doing to you and how it feels. But it's super important for you to do. It doesn't need to be this long, drawn-out thing that you do. Even like the daily little bits that you do are going to help you long term. And a lot of that has to do with, the scar is not just on the skin, it goes much deeper through all the layers. And scar tissue continues to form and kind of bear down and tighten up even years after surgery. So these surgeries are not no big deal. For many people, it can like kind of be a cascading event of other issues that happen. So it's not unlikely that during this time, if you suffer from back pain or other things like that, or if you have chronic swelling, that it's going to be like a catalyst for these issues to kind of crop up. So, um, doing your self care and doing things that you normally do to take care of yourself and kind of maintain your healthy are going to be super important at this time, too. And now that you've had this big surgery, the scar massage is going to have to be one of those things, too, that you're going to need to incorporate into your daily, weekly, regular self care. So, I personally find that I have a C-section scar that sometimes gives me a lot of pain. I have back pain. The two are not necessarily related, but when either one is not functioning well, I mean, it's all in the same area and everything in our body is connected. So it's not independent either. So the more religious and diligent I am with doing my scar massage, the better. And I kind of incorporate it with, trying to break up the cellulite too at the same time. So it's just something, of course, I'm better with it when it's shorts and swimsuit season than I am in the winter. But in general, I'm pretty good. And I find it most easy to do this kind of stuff in the bathroom and when you're getting either in or out of the shower. I'm sure you've seen like the dry brushes. Those are great to do. Obviously, it's a dry brush on dry skin. I like these ones that have bristles and also the nubbies, especially as you're progressing, but this is usually where I start. And usually you want to go up and down across your incision and then side to side, and circles are good. You're just trying to move the tissue and encourage movement and blood flow and lymph flow and all of that. So there's definitely ways to do it. I can point you in the right direction with that stuff as well if that's something that you need. But I tend to start with a brush because they're fairly inexpensive and it's softer. And once that becomes easy and you feel like you need something deeper, what I've found is the gua sha tools. It's not dirty, it's just kind of faded looking. But these tools can be good as well. So you can use the ridged edges are great if you're having some swelling and things like that. You can use the smooth edges to push fluid in that area. Using a corner is great if you find kind of a restricted area. And I like to do it with like the soapy body. It just makes things slide and glide a lot better. Or you can do it if you're doing like body oils after you're all clean. Once your incision is closed, you can kind of do anything. Your scar will take up to a year for it to look better, but that incision is always going to be a little bit weaker than other spots. So encouraging blood flow and getting things moving is great by using some tools. So we've got the brushes, you've got the gua sha tools. I also like to use my wooden mushroom. I'll use that on my legs and my cellulite, but I'll also go across my abdomen as well and kind of get into those tools, those little nubby things in there. You can see that the bristles from the brush are not as big as the nubbies. So this is kind of like a more hard tool that has deeper projections, is going to obviously affect deeper tissues. So it's going to get a little bit deeper. So those are like progressions from starting with just your hands to moving to different tools. And then there's even like a cool ceramic one that I really like as well. And it's great for getting in knots and things. there's so many different things out there. There's so many different products out there. Try some different things. Try not to get super anxious about what it's going to look like, because there are so many options for you out there. There's cosmetic, aesthetic offerings as well. Lasers can smooth out and improve the appearance of scars. Some people will respond well to microneedling. Some just don't like, it just never looks right, and they'll go the route of medical tattooing or decorative tattooing. And then there's also scar revision is always an option as well. So I like to tell folks that are really concerned, like, that you're going to have to give it time, because while it's super apparent to you right now and it's all you can see, once that wound is healed, you get back to doing your regular thing, then you may not really even notice it anymore, and it may or may not bother you. So you don't have to rush to make these big decisions. You can kind of like wait and see. So I hope that's helpful, and I appreciate any comments or shares, and just trying to get this thing started. So if you know anyone that you think I should talk to, please let me know. And if you're someone that is dealing with an open wound, or you're working with a client who has an open wound and you need some support, have them reach out. You can find me at betterwounds.com. You can book your own virtual consult at the /shop and use code podcast for a discount. So I hope you're doing well and you're progressing and things are doing fantastic and you don't need me. But if you do, you know where to find me. Hope you're good. Talk soon. Bye.